All right, so I'm looking at my information for my client Betty. First, I'm going to look at my Omnicell and my MAR and compare the medications. So I'll get the tablet for the lisinopril, the multi-dose bottles for the insulin, the tuberculin tests, the powder and distilled water, and then I have a double order for morphine. So I'm going to call my provider and double check on that and give him my recommendations. So first, I want to figure out with morphine what is going to be. Okay. So according to the history, my client is opioid naive. So with this, rating her pain at a 9 out of 10, I would recommend 10 milligrams. So I'm going to call the provider and talk to him about that. Hi, Dr. Johnson. I'm here with Betty, female, 45 years old. She came into the ER last night for abdominal pain, dry mouth, fatigue. Do you know who it is that I'm talking about? Okay, great. So I'm looking at her order right now. I'm about to give her some medications, and it looks like we have a double order for morphine. I wanted to recommend, with your approval, that we discard the 30 milligram IM stat dose of morphine, and then the other order is a 15 milligram IM stat dose. And according to her history and the dosage that I was looking at in my book, with your approval, I would like to recommend a 10 milligram IM stat injection instead. Okay, good. So then just to reiterate, we're getting rid of the 30 milligram IM stat, and we will be changing the 15 milligram to a 10 milligram IM stat of morphine. Okay, great. Thank you so much. Okay, so now that I have that cleared up, I've got all the supplies that I need. I've got my medications, the syringes that I'll need, the alcohol pads, cotton swabs, Band-Aids, anything else that I'm going to need for my patient. Okay, so I'm going to knock on the door, enter the room. Hello, my name is Dee. I'm going to be your nurse today. Assure privacy. So I've got some medications for you. I do know that you speak Spanish as well, so just to be safe, to make sure that our communication goes well, I'm actually going to have an interpreter come in. He's on his way. So we'll have an interpreter with us today as well. That way there's no communication problems and you're able to understand everything that we're talking about, okay? So I'm just going to get these medications ready first, and then we'll continue, okay? Awesome. So I'm going to hand hygiene, wash my hands, and get my gloves on before I prepare my medications. And Betty, in your chart it says that you don't have any known allergies. Is that correct? Okay, great. As I give you each of your medications, I'm going to double check in with each of them and make sure that we don't think that there's anything that sounds familiar as an allergy, but I just wanted to double check on that. Okay, so before I begin for the 10 rights, I've got my right client, and so I need to identify, and because I didn't ask her for her name or date of birth, I'm going to ask 2 other identifying questions or scan her barcode on her wrist just to confirm that it is the right client. I'll have the right medications, right dose, right route, right time, right documentation, right education. She has the right to refuse, the right reason, and the right evaluation. So those are the 10 rights, and I want to make sure that I go over them with her every time that we discuss a medication. Okay, so to start the medication, first I am going to do the lisinopril. I have a 20 milligram tablet by mouth, and according to my MAR, I only need 10 milligrams. With that, as far as that dosage calculation goes, I know that 20 milligrams, half of that is 10 milligrams. So for me, that's just, I'm going to cut that in half, and I only need half of this pill. So first, I'm going to clean off my pill cutter, make sure I don't have any residue from any past pills. Okay, and then with my 20 milligram to get the 10 milligrams, I'm going to line it up and cut it on the scored marking of the pill. I'm going to take the 10 milligram half that I need and put it in the cup for my patient, and then discard of the other half according to my my facility procedures and policies. Okay, and then I'll have some water for her to take. Okay, next I'm going to do, so that was my first check, or my second check with my lisinopril. So I was able to see that I have the correct dose. These will all be given at the correct time. It's the correct medication. I'll be educating my client, letting her know she has the right to refuse. I'll document it correctly. It will be given the right route. It says PO, and I have a pill that it will be given by mouth. And then let her know the reasons behind it, and then her evaluation. So moving on to the insulin. First, I'm going to roll my insulin to make sure that they are nice and mixed up. I have regular insulin 9 units and NPH 16 units. So first, before I begin, I'm going to clean off the tops with an individual with their own alcohol pad. I'm going to take out my syringe, and I will be first putting air into the NPH. So as my second check, I need 16 units of NPH. I'll be pulling back 16 units of air. Remove my swab. And I'm going to make sure I don't touch the NPH solution. I'm just putting the air in. Okay. Now I need 9 units of regular. I'm going to pull back 9 units of air. Inject the air into my regular insulin. Invert it and draw 9 units of regular insulin. Making sure I don't have any bubbles. Okay. So as my second check, 9 units of regular, and I have 9 units of regular insulin drawn. Okay, I will then invert it, pull it out, and now I have my NPH. I'm gonna roll it again just a little bit. And as my second check, I need 16 units of NPH, which comes to a total of 25. And this is something that I'm definitely gonna be checking with a second nurse to make sure that I'm doing it correctly, that my calculations are correct, because it is insulin. So I'm gonna go into the NPH now, and if I overdraw, I have to start over. So now I will be taking back 16 to give me a total of 25. Okay, here, I'll do this first. So I have exactly 25 units. Let's see. Oh, there we go. 25 units, okay? And I will be giving this later, so I am going to recap my insulin for later. So that was my second check. Okay. Okay, so for my third medication, I'm just drawing for the tuberculosis test. So the TB test calls for 0.1 milliliters. So I'm going to clean this off. Pull back 0.1 of air. Cover my cap. Go in, invert, and draw back 0.1. Looks like I've got a big bubble. Get rid of that. There we go. Okay. Okay, and I have exactly 0.1 milliliters, 0.1. Okay, so my TB test is correct. I've done my double check for that. I need 0.1, and I've pulled back 0.1. Next is my morphine, and this is one that I will have to do a dosage calculation on. So with my morphine, it's been changed to 10 milligrams. And what the Omnicell has given me is a 20 milligram bottle. This is also an easier math that I don't feel like I need to write out the equation. So if I have 20 milligrams per milliliter and I only need 10, 20 milligrams cut in half is 10, and 1 milliliter cut in half is 0.5 milliliters. And so that's how I'm going to do the math on that, and I will double check that with a second nurse and make sure that that is correct. So I'm going to draw back 0.5, air, recap. I'm going to recap because I did not clean it first. I'm going to clean it first. And with my double check, I am making sure that the bottle does match what my Omnicell said and making sure that all this match up. So I have confirmed that this is what I need. This is the right dose. So I've pulled back my 0.5 milliliters. Go into my bottle. Put my air in. Turn it up. And draw my 0.5 milliliters. Little bubbles that I'm going to get out. And I'll show my amount once I get these bubbles out. Okay, so I have my 0.5 milliliters of morphine. That is my second check with my morphine. Okay. And last, I will be doing my reconstitution. So I have 5 milliliters of distilled water, and then I have my 1 milligram of ampicillin in my powder vial. So according to the vial, I need 2.5 milliliters to dilute this with. And once that is diluted, then okay, so I have a 1 gram vial, but with it being diluted, it will be 330 milliliters, 330 milligrams per milliliter. So, I don't need any sort of math because the order that it's given is what it will become once it is diluted properly. So, with the proper dilution of 2.5 milliliters, 1 milliliter will be the 330 milligrams. So I'm going to take my dilute first, clean this off, clean off the top for my unconstituted powder. Okay, I'm going to draw back the 2.5 that I need. Draw back 2.5. Okay, so I've got the 2.5 milliliters of dilute. I'm going to go directly in to my powder. And this is going straight into the sharps container. And it says in the directions that I can shake it. I don't just need to roll it, so I'm just going to make sure that I get everything completely shaken up like it needs to be and mixed in. And because I touched this vial, I'm going to clean it off again before I draw my medicine. So this will be my second check. I've checked that it is the correct amount of dilute that I put in, and I know that I do need 1 milliliter for the 330 milligrams. So I'm going to pull back 1 milliliter. Put the 1 milliliter in, and then draw back my 1 milliliter. I do have a bubble, so I'm gonna get that bubble in there. Okay. Now, I'm at exactly 1 milliliter for my ampicillin. So, for my second check, 330 milligrams is 1 milliliter. My order is 330 milligrams for 1 milliliter, and I have 1 milliliter here. Okay, so I've done my second check, and now I'm going to move on to my patient. Okay, Betty, so we have our translator in here, and we're going to start administering the medication if that's okay with you. Before we start, I want to go over your 10 rights, okay? So, first, if I can see your barcode, I'm going to scan that and make sure that it matches my MR, which it does. And then can you give me your home address? Okay, awesome. Perfect. So I have confirmed that it is you. You are the right client. I have the right medications and the right doses, the right route, the right time. I will be documenting them right. You do have the right to refuse any of these medications at any time. So at any point, if I educated you on a medication and you don't feel like you want to, you have the right to refuse them. You have the right reason, right evaluation, and I'm going to start over because I only have 9 fingers held up. So, right client, right medication, right dose, right route, right time, right documentation, right education, you have a right to be educated, right to refuse, right in reason, and right evaluation, okay? So if there's okay with you, I'm just going to go ahead and move forward, okay? Okay, awesome. So I'm going to start off with your morphine. It is a stat order. Because you've rated your pain at a 9 to 10, I'm going to go ahead and do that first so we can hopefully get your pain feeling a little better, okay? So for my third check, I'm going to take my morphine. I need 0.5 milliliters. I have had my dosage calculations checked by another nurse, so it is confirmed that we need 0.5 milliliters. So I've done my third check. I know that this is the correct medication. It is the right client. It's the right dose. I am giving it stat at the right time that it was ordered. The right route, which is IM, and I'll be documenting this. My client does have the right to refuse. I'm going to make sure I educate my client on this medication, and it is being given for the right reason, which is pain, and I will evaluate my patient once it's given. Okay. So, Betty, what we have here is this is morphine. It is a painkiller, and so this is what we're going to use to treat your pain today, at least right now, okay? So a few things about morphine. It does work as like a sedative kind of, so you might feel a little bit tired, maybe a little confused, a little dizzy. It is going to kind of put you at a fall risk, so if you do need to get up or move or anything, please ask for help. We don't want you falling, and it could make you feel a little off balance and things. It also can cause constipation, so we want to be aware of that, and it's going to bring your respiratory rate down. So we want to make sure that it doesn't bring your respiratory rate down too far. So that's going to be your breathing. So it's going to kind of calm your breathing down a little bit, all right? But hopefully this medication is going to help calm you a little, make you feel a little bit better. And then we'll evaluate if it's working, if we need to adjust the dosage, and how it's making you feel, okay? So first, we are going to go right here this is called your vastus lateralis. We're going to go right here in this muscle, okay? So I'm going to go ahead and move this back here. I'm going to tip you back just a little so that you're comfortable. Okay? And how I want to find this muscle is I want to be here at the top of the hip and down here above the knee, and it's going to be this muscle here, right in this area. So what I want to do first, I'm going to observe the area. It looks like everything looks clear. There's nothing that would give me reason to not inject it here. I want to clean the area and allow for time to dry. Once that is completely dry, I have my morphine. It's dry. I have my morphine. I'm going to take off the cap. I'm going to Z-track, so I'm going to pull the skin off to the side, going on the count of 3 at a 90-degree angle. 1, 2, 3. Okay. And then I'm going to go in at 1 milliliter per 10 seconds. So I'm going to inject it slowly. Okay, pull out. I'm capping and putting it directly in my sharps. And then I've got a cotton swab that I'm going to cover it up with and then put a Band-Aid. Okay. Don't want to rub it. We want to pay attention to if you have any irritation at the site, any rash, any reactions. Okay, awesome. We're going to move on next to your lisinopril. This is a oral medication. Betty, do you have any problems swallowing, or are you able to swallow pills? Okay. Okay, great. So again, remember you do have the right to refuse this. I've made sure that this is the right dose. So I need a 10 milligram by mouth. I cut 20 milligrams in half. So this is the correct dose. This is the correct medication. PO is the correct route. I am giving it at the right time to the right client. I have given you the right to refuse. I will educate you on this, document it correctly. It's being given for the right reasons, which I'll educate you on, and then I will make sure that we evaluate to make sure it's doing its job correctly. So, lisinopril is going to be for your blood pressure. So you came in, your blood pressure was about 150/88, which is a little high, so we want to bring that down a little. Things you do want to watch out for, we don't want to bring it down too low, so that would be hypotension. Things to look for is like cold, clammy, fatigue, not feeling well. So we're going to pay attention to things like that. We'll be taking your vitals and keeping an eye on that. And then also because you're going to be taking it by mouth, I want you to pay attention if you get a rash or if you get sores in your mouth, if your throat gets a little bit sore, maybe like an irregular heart rate, because it does deal with your blood pressure and those things. So pay attention to some of those things. Let us know if you have any nausea, vomiting. Those are things we really want to be aware of, and make sure that you don't have any allergies to lisinopril. And so if you don't think that you have any allergies, then I will go ahead and continue, and if you're okay to take this medication, we'll move forward. Okay. If you don't need assistance, then I'll just hand this to you. Okay, great. Aaron, here's your water. Okay, and just go ahead, open your mouth, show me that you swallowed. Were you able to get it down? Okay, awesome, perfect. Okay, so we're gonna move on then. So I'm gonna do a TB test, and this is because you've traveled from Mexico, and it's just kind of precautions. We just wanna make sure that you don't have it. It's gonna be an injection right here on your forearm, and so we'll just bring your forearm out. We will check it in 48 to 72 hours. If you do have a positive TB test, what you'll see is redness, rash, bubbling, inflammation, just a reaction to this. And Betty, do you know if you've had a immunization, a TB immunization when you were younger? You haven't? Okay, great. That can cause its own irritation if you've had one when you were younger, but since you have not, we'll be monitoring it closely for a reaction and then move forward if we do believe it's positive. So, it's me right here on your forearm. I'm first going to clean your forearm area. So your forearm is up here. And I'm going to clean off the area. Let it dry. For my third check, I am making sure that it is 0.1 milliliters like it calls for, and that is correct. So I do have, I've done my third check and this is what I need. So take off my cap. I'm going to pull back the skin just a little. I'm going to go in at a 10-degree angle, an eighth of the way in, and it's just the very first layer. Inject slowly to where we see a bubble. Great, and pull out at the same angle. I don't want to, I'm going to put it directly in my sharps. I don't want to put pressure on this or rub this, so I'm just going to lightly dab it. I'm going to document that it was on the left forearm. I could draw a circle if I wanted, but I'll just document that I put it there. I'm going to put a Band-Aid over, okay? Okay, great. And then in 48 to 72 hours, we're going to check on that and just make sure that it is negative, okay? Now we're going to do insulin. You came in and your chart is showing that you are a new diabetic, and so your last reading was 240. We want your levels to be down. your blood glucose levels be down around 140. So insulin is what helps us control your levels and bring your glucose levels down. So what I have in here is I have 9 units of regular insulin and 16 units of NPH. This is my third check that I'm making sure that I do in fact have the 25 and it is correct with my MAR, which it is. And it is the correct medicine, giving it subcutaneously, which is the correct route. You do have the right to refuse this. So for your education, we already talked about how to bring your blood sugar down. Things to watch out for is hypoglycemia, whereas maybe we bring it down a little too much, and that's going to be symptoms like fidgety, dizzy, shaky, sweating, hunger, elevated heart rate. So we want to watch for that because we don't want to bring your blood sugar levels down too low. But then also, if it doesn't do its job and we aren't monitoring your levels well, you can get hyperglycemia, which is your blood sugar levels are too high. That's when you're going to be feeling maybe nausea, fatigue, vomiting. Those are things to be looking for. And so we want to make sure we get that happy medium. Make sure to let us know if you can't eat a regular diet, if you have a hard time managing those levels. I'm going to go ahead, we're going to give this right here in the back of your arm. It's just right here in the subcutaneous area, it's just in like the fattier area so that it doesn't go into your muscles. Okay, and then you do have the right to refuse this as well. I know I mentioned that, but so in order to do that, I'm going to have you sit up. Okay, great. And I'm going to inspect the area we'll be giving it. Everything looks good. It'll be right here on the back of the arm. Wipe it down, let it dry. And then it would be back here. I would be pinching the skin upwards so that we can get it in the subcutaneous area. And so if this is on the back of her arm, I would pinch up, 1, 2, 3, and then put it in slowly. Leave it in for 10 seconds. Just as I did with the morphine and any other intramuscular injections, they are left in there for 10 seconds before being taken out. I'm going to put my cotton swab on there and a Band-Aid. Don't want to rub it, anything like that. So we also want to pay attention to any irritation and those other side effects we talked about. So let's just pay attention to how you feel. Don't feel shy or hesitant to let us know if you're not feeling well, if you notice something that's not normal, okay? Lastly, we have ampicillin. So for my third check, I'm just going to double check. I needed 330 milligrams per milliliter. There is 330 milligrams per milliliter once it is reconstituted. So this 1 milliliter is the correct dose. It is IM, which is the correct route. It is the correct medicine. It is the correct patient and the correct time. I will be documenting this as well. And then remember, Betty, you do have the right to refuse. I will educate Betty. It is for the right reasons and the right evaluation. So what I have here is ampicillin. Now when you came in, we did a chest x-ray and found that you do have pneumonia. And so this is an antibiotic that is going to help with your pneumonia and help clear it out. One thing that's important to know about an antibiotic is even if you start to feel better, you don't want to stop taking it. You need to take it for the course of your prescription. And so we're going to be giving this every 12 hours. We want to make sure it stays in your system until we've completed the entire order. A couple things to look out for. It can mess with the healthy bacteria. So we're going to be watching for diarrhea because we don't want you to contract C. diff. Something that can be caused with a lot of antibiotics. We want to watch out for any allergies that you might have, if you have any allergies to penicillins or different antibiotics. And you don't, okay, so yeah, it seems like your health record, you don't know of any known allergies for this. Other things to be aware of is maybe vaginal itching or fuzziness on your tongue. We have problems with yeast and different things with antibiotics, so we want to be careful of that. Do you have any questions? Okay, great. So this injection is going to go in your vastus gluteal. And so what I'm gonna do is I'm gonna turn on your side. And this will be your last medication for today, or for right now, with me at least. So I'm gonna lay you back and turn you on your side. Okay, let's go ahead and have you roll. That was not nice, Betty. Sorry, Betty. Okay, so how I want to find this is I want to come right here and up to, we've got like our hip bones and like sacral area. So I have my landmarks that are much easier to find on a person. And I'm gonna V here. We've got a muscle that I'm looking for specifically that's gonna be in this area. And so we've got bones and different things, but we wanna make sure that we get this muscle that's right here in this area. It's a nice big muscle to use. And so this is where I'm gonna go with the ampicillin. Clean my area. Okay, now that it's dry, I'm gonna use my Z-track method again. 3, ready, here we go. 1, 2, 3. Z-track, I'm gonna go in at 1 milliliter per 10 seconds. Hold for 10 seconds. Take it out. And close. Put it into the shirts. Use a cotton swab. Don't rub over it too hard. And a Band-Aid. Okay. Go ahead and come back. I did assess the site to make sure that there was nothing on the skin that made it not a good area to inject. Okay. I'm gonna get you sitting back up to where you're comfortable. Just let me know when you want me to stop. Right there? Okay, great. Do you have any questions about anything that we talked about today or any of those medications? Okay. Those side effects we talked about, let's make sure that if anything does come up that you have any concerns about, just be sure to let us know. We want to watch those closely. I'm going to come back in about 10 minutes, 15 minutes for your like the morphine and your injections. Make sure that you're not having bad reactions and that you are starting to feel the therapeutic effects of some pain relief, and we want to start seeing your blood sugar come down. With your insulin, we're looking at about 30 to 60 minutes for that with the regular, and then we have the NPH, which helps extend that, and that's going to start acting in about 2 to 4 hours. Then with your lisinopril, we're looking at about an hour for your blood pressure to start coming down. Like I said, we'll check your TB test in about 48, 72 hours. And then every 12 hours, we're doing the ampicillin all the way through to make sure that we clear out your pneumonia, okay? Awesome. Well, if you don't have any questions, I'm going to go ahead and document this, all my medications, and then we'll be back to check on you really soon, okay? So I'm going to document that document all the medications I gave, their doses, the time that I administered them, the routes, and make sure everything matches the order that I was given. And then I will return to make sure there's no reactions, that they're working properly. So I want to come back within 10 to 15 minutes because of the IM injections, the morphine. But I also want to be coming back later as well because we have the PO, the lisinopril by mouth, and other medicines that are going to be more prolonged. So I'm going to come back later and make sure there's no side effects and that they are bringing down her blood pressure, reducing her pain, bringing down her blood sugar, and that there's nothing negative coming from that. So just to reiterate the 10 rights of my patient, I have the right patient, right medicine, right dose, right time, right route, right documentation, right education, right to refuse, right reason, and right evaluation. Good job, Betty.